Live on WFLA Now. Feel good and live your best life with Bloom Health Club. Here's Gail Guayardo.
Welcome, everyone. Today we're talking about skin conditions, major research, and also the mental health link to struggling with skin conditions with award-winning dermatologist, Dr. Seth Forman of ForCare Dermatology. Dr. Forman, it is so great to see you. Thank you for joining us.
Thank you, Gail. I'm happy to be here.
So I want to kick off and talk about how forward-thinking you are in the Tampa Bay area. You started leading research many years ago, and you actually opened up an entire center where you have doctors practicing, and you also have researchers hard at work.
That's absolutely correct. Thank you very much. We are doing that right now, and when we first met each other many years ago at my original office, when we were talking about a lot of other different types of ideas in dermatology, we've certainly expanded. For instance, at this moment, there are surgeries being done in a full operating room on the second floor of our building, which did not exist just a year or two ago for acute postoperative pain trials, in addition to all the dermatology clinical trials that I do for patients that struggle with skin diseases, sometimes on a daily basis.
So talk to me about some of the more maybe mainstream, maybe not so mainstream conditions that you're trying to deal with and the research behind them.
So we can start with some of the mainstream ones, such as acne. We do clinical trials for acne still. We have new devices, new applications that are trying to avoid patients taking a medication called Accutane for the most severe acne. And right now the jury is still out as the data is being collected. However, I am a very big fan of Accutane, which is not under research. It is certainly something that can be prescribed for patients with severe acne. If you go to some conditions that are also very common, such as atopic dermatitis, it's also known as eczema. It's that condition. It's incredibly itchy. It's very red, and it can cause thickening of the skin in the places that you're scratching. We're still doing trials for that because there are only a few medications available for atopic dermatitis. Even though they are excellent and safe, nothing helps everybody. So we're still searching for cures and for therapies for patients with something as common and routine as eczema.
And a lot of the research that you're doing here is published in major publications.
That is absolutely correct. There are articles for research that we have done for psoriasis, which is that silvery, scaly condition which you get in the scalp, your elbows, your knees, as well as a condition that's not as well known, which is called hidradenitis suppurativa, which is where you get painful boils and carbuncles under your arms, groin, other private areas, under the chest, neck. And it's very, very common. However, it's usually a closeted condition because people don't talk about it at Thanksgiving. We are doing trials for that as well, which is painful, debilitating, and often causes lots of depression and suicidal thoughts for patients with that condition, which is why you doing this type of programming all month is so important.
Yeah, we actually had Dr. Forman. You can watch him Wednesday on Bloom at 2 p.m. where we're dedicating our entire hour to mental health issues. And, one that surfaced, we wanted to get Dr. Forman on the show is the link between skin conditions and mental health conditions, because people get depressed. They start to emotionally spiral when they're going through from the pain, maybe from the way they feel that they look, and they isolate themselves. And I thought it was interesting that before anyone enters into your research, you actually have them go through mental health screening.
Absolutely. There is something called the Columbia Suicide Scale, which is a scale that patients must take. It is an exam, a test, a questionnaire that they must take so we can measure the effect of their skin condition on their mental health. And we measure it throughout the trial. And oftentimes you'll see an improvement in that scale. There's also other quality indexes we do. There's something that perhaps a lot of people haven't heard of. It's called the Dermatology Quality of Life Index. That is routinely questioned for patients throughout a trial. Sometimes a trial can last up to 3 to 4 years.
Wow.
That is absolutely the case with many of the trials that we do, especially if you take a trial. The longest phase of any type of trial as a drug gets approved by the FDA is phase 3. oftentimes that phase 3 trial lasts years.
That's unbelievable. You were telling us on the show, which again we'll broadcast this coming Wednesday, that, for a lot of people, when they find a trial, they have exhausted every other form of treatment.
That is absolutely the case. You and I can go through a laundry list of dermatological skin conditions and talk about what the mental health aspects are of each one. Always worried about what you're going to dress, worried about what other people are going to say. Maybe you don't have any friends. Maybe you've withdrawn yourself to where people don't even know what type of skin condition you have because you've never even reached out, where you just go to school and you go home. You go to work and you go right home. You don't talk to people. And now that there's so much remote work, you never have to leave the house if you don't want to, and remote school for that matter. So as far as it's concerning the mental health aspect, it's incredibly important. And these patients do need therapy, and they do need attention in one way, shape, or form.
Yeah, it's a support system. And then also, I mean, for the underinsured or people without insurance, many times being part of these clinical trials can be a game changer for them.
Yes, clinical trials can be a game changer for patients who have not responded to therapies that are FDA approved, that any physician or doctor can prescribe a medication for you. And it's for patients and people that perhaps do respond to known therapies but don't have access because of they're uninsured, they're unemployed, or perhaps they may have mental health issues themselves that don't make them respond to normal therapies or even respond in a way to seek out therapy in itself. And I'm not talking about mental health therapy. I'm talking about therapy for their skin condition in this regard, or any condition that anyone's doing a clinical trial for. We don't just do skin trials. We have other types of trials for which patients are also struggling.
So talk to me. I know I followed you for years, not only as your patient, my kids were your patients, but I've followed your career while wearing my journalism hat at WFLA News Channel 8. And, you've really broadened the horizons over the years as to what you're doing.
So some of the other rages going on right now, we did the original Zepbound or Mounjaro trials with Eli Lilly to get that GLP-1 medication approved for obesity. We did those trials. Yes, we did. We also, at this moment, we are probably finishing our third or fourth surgery at this time for patients for acute postoperative pain trials. We're not testing the surgery itself. What we're testing is the postoperative pain medication that are non-narcotics in order to prevent people eventually to not need narcotics in a postoperative setting so they don't become addicted. As we know, and we've both had as a healthcare provider and as a journalist, we both had a front row seat to the devastation of what narcotics have done to both Hillsborough County and the surrounding areas, as well as the rest of the country. And if we can help get people off narcotics by not even starting them on it, that's the win. Yeah. It's a big win.
It's a huge one. It's a huge one. What takeaway, were there any highlights that you can share from the research? Because all we're talking about lately is this new class of weight loss drugs. Do you see that? I mean, articles in Forbes magazine, everything, Wall Street, everybody says that this is just the tip of the iceberg of what we're going to see.
That's absolutely the case. As we were finishing the GLP-1 trials, which is the whole class of the injectables, you've heard of Ozempic and Wegovy and Mounjaro and Zepbound, they all operate on the same mechanism of action inside the body. However, those are injectables. There's a whole class of oral medications that are in trials right now that not just have the GLP-1 agonist, but also have a few other elements to it that can make it even more successful for weight loss.
And what's really interesting to me, because we've had so many physicians come on our show and talk about that this is the greatest thing they've witnessed in the last 3 decades of medicine, and not just for diabetics, but just, the other side health benefits, especially for women. And, they're talking about it for not just short-term use, but for women, especially getting on long-term maintenance protocols just because of the other health benefits that come along with this class of drugs.
This is just one example of the type of research that we're doing, or a few examples of what we're doing at ForCare Clinical Research, also known as Senexcel FCR. But when I speak to people like yourself and to other physicians as well as other providers and patients, what I say is we're developing a medical research hub on North Florida Avenue. We can expand. We are hoping that doctors will put their private practices right next to our office, right in Magdalen Center, in the parking lot right next door, because we are getting offered more trials than we can even handle right now. So if you put your private practice right next to our office, we will use you. We have trials for Parkinson's. We have trials for Alzheimer's. There's still no wonderful drug for Alzheimer's. There is one that has been approved, but the data is not incredibly strong. Actually, there's a few out, but one just recently, but the data is not that strong, that we're getting offered Alzheimer's trials that we can't do yet because we don't have the personnel. So we're hoping to bring other private practitioners to the area, either at ForCare Clinical Research Center to have their private practice in our building, or to have their private practice right next door and create that medical research hub that we're already the largest clinical research site in the region. Non-university based.
Yeah, that is incredible. And there are so many advantages that come with this academic research combined with medicine. I mean, it's the business model of one of the nation's largest hospitals, Tampa General Hospital, and its partnership with USF Health. We're seeing this all across the Tampa Bay area. And as people that live here, we get to experience, how that model takes healthcare to the next level.
Absolutely. Tampa General and USF is an amazing partnership. They are both amazing institutions. At ForCare Clinical Research, we're doing it in the private sector. However, we both have the same goal, which is to provide new and exciting therapies and perhaps even cures to people that are suffering with any number of conditions.
Now, I know that you met Tampa Bay, a digital reporter, BloomTampaBay.com digital reporter and lead producer, Brody Waddell. You guys worked on an article together. Your thoughts on working with Dr. Seth Forman?
Well, I worked with him a little bit. I haven't quite gotten those insights yet. I'm going to have to email those for you. But we did put something together, and I did a little bit of research into you, and it's interesting that you are so much more on like the actual research side as opposed to the treatment side. That's sort of interesting to me. Can you speak on why what drew you to that?
Well, it appears that way because that's how a lot of our materials are promoted as such. However, I still have a very busy private practice. I believe when I last checked, I have 42 patients scheduled, similar to the patients that Gail was referencing. I don't think it's any of your kids, but I think I certainly have a lot of patients tomorrow just have routine issues, warts, acne, very mild eczema, maybe a drug reaction, a skin cancer to do a biopsy of. However, what I do in my spare time, which is ridiculous, I feel like I have 2 or 3 full-time jobs. I do my private practice almost full-time, and I'm doing clinical research almost full-time as well. Somehow I squeeze it all in. I'll see my research patients in between my regular patients, that it's almost flawless, and the patients won't even notice that I'm seeing a patient for, say, a wart, and then the next room is a patient that may be getting enrolled in a clinical trial. So it's sort of seamless when it comes to the cutaneous trials. For the ones that are not skin-related, of course, that's a little different. Those patients are not going to be checked into a dermatology clinical research site. They're going to be checked into the non-dermatology site. And we still do a bulk of dermatology at our site.
Right.
What steered you in that direction, though, Dr. Forman?
Steered me in the direction of
adding in the layer of research, because when I first met you, that wasn't part of it, or if it was, it wasn't as highlighted as when you're in your office in Magdalen. Is that correct? Is that where it was?
That is correct.
So when I was seeing you there with the kiddos, were you in the research arm yet?
So it's interesting that you bring that up, because that was where I got my first little taste, but it wasn't as what we call a principal investigator. I was what's called a sub-investigator, and it was for a research site here in Tampa, a historical research site. It was Dr. Sergey was in charge of it at the time, where Dr. Sergey, this senior, where they needed skin exams for some of their MS medications that they were testing. So they needed to have a dermatologist do a full skin exam, because there is a risk or there was thought to be a risk that patients that try certain MS, multiple sclerosis, or Parkinson's drugs, as well as some of the Alzheimer's medication, may have an increased risk of developing skin cancer. So they had to have somewhat routine exams by a dermatologist. So they were sent to me from this neurology site. And then I said, well, there must be skin research going on too. So I kept on asking and asking and asking. And then finally someone showed up when I moved to my second office on Ehrlich Road, where someone had found me and said, I heard you were interested in doing clinical research. And I said, yes, I was. And the first trial that I had done was with AbbVie, or adalimumab, also known as Humira. And it was to help get the indication for Humira for this horrible condition, hidradenitis suppurativa, which is that painful boil condition. And from there, if you do a good job in whatever you do, other people notice and
it's just
want you to continue. It kind of snowballs.
Right. Interesting. Is every skin condition a puzzle to be solved to you, or some of them, like there's just nothing that can be done, or is it just
Well, I will say this. We're not supposed to say this in medicine. However, I still believe that Accutane, isotretinoin, is a cure for acne. Eventually, you can cure acne with isotretinoin. Now, am I as worried about patients that have minimal acne that just don't want to take any topical medications and don't want to have it on and off throughout their teenage years? I certainly worry about them a little. But the people I really worry about are the people that I know, if left unchecked, they will get those scars that you see. And fortunately, we don't see that much anymore. Yeah. And it's because of Accutane. So I still believe that Accutane is curative for acne.
Can I answer your question too, Brody, about the puzzle? Because I have a great story that just popped into my head about Dr. Forman. And I don't even know if he's going to remember this, but we had taken the kiddos to Orlando, and we were at one of the hotels with one of those lazy river style pools. And my daughter, who's the one that's about to graduate from high school and go off to Florida State University, was just a toddler, maybe pre-K 4 or kindergarten, and she loves limes, and she was out there eating limes, and the juice is dripping all over her, and we're not thinking about it because there's a pool right there, and she was jumping in and out, in and out. And then we get a call from her elementary school that they noticed that she had like these burns on her body. And I'm like, they called me in, and I'm like, I have no idea what this is, or what could have caused this. And of course, whenever they call you in for something like that, it immediately raises suspicions of like maybe the parent, something nefarious is going on. So I rush her to Dr. Forman, and immediately like he walks in and rattles off some term of some kids that, or adults too, that when you have a citric acid juice mixed with sunlight, it almost has the same effect as a chemical peel. And you spotted it right off the bat. What is it?
I did. It's called phytophotodermatologist. Phyto being plant, Phyto, then photo meaning sun, and dermatitis, I think, is somewhat self-explanatory. So I want to thank Gail for those brief moments in my practice where I get to look very, very smart, but that is a textbook condition. But not only is it textbook that we can provide the answer for, but to a worried parent to also tell her that her daughter does not have some type of serious medical condition that it will simply resolve on its own. Now, usually a youngster such as Gail's daughter, who's, well, she's still young, but not as young as she was. What I worry about now, and you have to remind your daughter, because when she goes off to Florida State and some person, somehow she finds herself at a sorority party or a fraternity party, and she starts having these things called margaritas. Yeah. And then usually what happens is with the adults, they get it much worse because they've had multiple margaritas, and some of them actually make the margaritas. So I had one very good friend who had it all over both arms. And I said, well, I can't say his name. I said, I've never seen it on both arms. I said, but did you have a margarita or spill one on your arms? And he's like, spill them? He's like, I had 3 or 4, and then I was making them for everybody all day. I was like, whoa. Dude. It was like, it looked like he reached into a volcano and took his hands out.
Isn't that crazy? And he also wrote me a note, so the school knew that it was
we bailed out.
Yeah,
we gave one to our attorney as well and our parole officer.
We lives by the pool was a lot different than whatever else was going through their mind. So so every case must be a puzzle. Now, if my memory serves me, didn't we also talk about treatment protocols that were very cutting edge back in the day when it came to skin cancer.
Yes, and actually those have even been updated because now we do an even more sophisticated type of skin cancer therapy. We use electron beam, which is even more scarless, even less painful, and really targets only the tumor cells as opposed to the x-rays that we were using years ago, which are sort of non-selective for skin cancer. So you'd actually have some good tissue that was destroyed along with the tumor tissue, which of course the tumor is what we want to destroy and we want to preserve as much of the good cells as possible. So we've been doing that. That happens to not be a research protocol. That is actually an active therapy that any patient can sign up for at our site. Well, it's not our site, at our medical practice. But yes, that's now been updated. We have a much bigger machine, which of course it came at a much bigger cost, but it's a wonderful therapy for patients, and it really has changed a lot of their lives to prevent. Imagine having a skin cancer that consumed almost your entire eyelid.
Yeah.
The surgical options are not entirely, if it's amenable to radiation, you can preserve an entire body part. I mean, a small body part, but how about above the lip? It's very easy to repair the lower lip surgically. The upper lip, because of the nuances of the upper lip, it never looks right if you actually have to disturb the upper mucosal portion of the lip. So radiation is a wonderful therapy for there as well. Unfortunately, it's only for basal cell carcinoma and squamous cell carcinoma. The radiation therapy that we utilize is still not for melanoma, which of course is the most dangerous type of skin cancer.
Interesting. That's really, really interesting. Any other questions for the good doc?
I want to ask you, doctor, why do people seem to age so much better now? And on that same token, there's been this whole thing going around that Gen Z is aging so much quicker than millennials and sort of the generations above them, looking wise. Can you speak on maybe why that is? Like, is there something we're doing with our skin? Because it seemed to have gotten a lot better where, you know, people used to sit out in the sun with those freaking mirrors and stuff like that. But like, why is it like sort of everyone's staying younger for looking for longer and now they're like aging quicker again?
Well, there's a few reasons for that. And I think the reason why people appear to be aging less, they're certainly aging at the same rate that they were prior to any of these therapies. But some of the cosmetic treatments out there, I think, certainly have enhanced the ability for patients to preserve the texture and the constituents of their skin. And the other reason, which just happened somewhat just a few years ago, is now a prescription for a medicine called, I don't know if I can even use the brand name. I can't. I'm trying to think of the generic name, and I can't think of it right now. However, it's out there, and it's adapalene. And it used to be a prescription. Adapalene is a variant of Retin-A. Retin-A, we know, if you apply it to your skin enough, it can preserve your skin and reduce the signs of aging. And that's something that's been well known for many years. In fact, there are people who do this. I do not. Please don't come to my office for this. Accutane is a variant of vitamin A. It's just a high dose vitamin A, which is what Retin-A is topically. It's just a topical Accutane. There are people who prescribe low doses of Accutane for people to actually reduce the appearance of aging in their skin. It does work. I happen to not recommend it. I don't believe that's not my style of therapy. I also don't consider myself a cosmetic dermatologist. There are people in the area that's certainly more educated on these types of therapies than I am, and I would recommend someone go there for that reason specifically. But there are more available therapies. Some of them are not even prescription-based, such as adapalene, which is available just at a pharmacy, over-the-counter pharmacy, which we know reduces the signs of aging.
I had a question. I'm working on high-tech healing, and I've been doing a lot of research, and I've been out in the field, and it's a show that's going to be airing, I believe, in early June, if I'm not mistaken. But does all of this new light therapy and laser therapy, I mean, it's being used for everything from, physical healing to traumatic brain injury to cosmetic. I mean, the laser and light world is really exploding. Yeah. Is that something that you're going to see in dermatological care?
Well, it seems as if people usually go for dermatological indications first because it's somewhat easy, and usually it's something that's based on cash pay only. You don't have to rely on Medicare, other types of private insurers to pay for something. So it's an easy, low-hanging fruit type of scenario for cosmetic issues. We don't do a lot of device. Actually, let me strike that. We don't do any device trials at our site. So as far as things that I've heard of, such as you had just mentioned, Gail, TBIs, traumatic brain injuries, sterilization techniques, I'm not familiar with those on a personal or professional basis. However, I've heard about that in other scenarios. I can only speak to dermatology that there are new devices coming out every year. But I'm not as familiar with them as I am with sort of the therapeutic devices for skin cancer, which we talked about just recently. So
What about for acne?
for acne, there is data to support using a blue light with a topical therapy. However, if you're going to go that far and get those therapies, because it has to be done repetitively, it's not curative, you might as well get Accutane for 5 or 6 months if you can handle it and cure your acne. I mean, 7 out of 10 patients that go on Accutane don't need any acne medicine ever again. Some people need another course, but 7 out of 10 is pretty darn good.
That's amazing. Isn't that incredible?
That
A
is
cure for
incredible.
acne.
I hate to be boring.
No, I
Accutane's
find
been
it to
around
be
for
very
like 50
interesting.
years,
Yeah.
40, 50 years.
Why do I know so many people with pocket scars that say they were on Accutane as a teen,
Well,
on their cheeks and whatnot?
right. Well, that's a great question, Brody. Probably because they didn't get the therapy in time. And I do have some scars myself, and my parents never put me on Accutane. My brother went on Accutane. I guess I liked him more. Don't get any ideas, Jonathan.
Wait, the one that took my kid's tonsils out?
Well, okay, fine. He's smarter than me. I've heard it my entire
These
childhood.
squirmy guys, they're everywhere. You can't shake them.
That's hilarious.
I'm just kidding.
Yes, that one.
Yes, that one. Well, listen, this has been an amazing conversation. You're an amazing doctor. We're so lucky to have you in the Tampa Bay area. And I hope if there are doctors or anyone in the clinical setting that want to move to Tampa Bay or live in Tampa Bay already that might be listening to us, that want to be part of this incredible project. And, you know, the real estate is there. All they got to do is occupy it.
We are looking for neurologists, psychiatrists to get involved in these Alzheimer's, Parkinson's, major depressive disorders, schizophrenia trials. They are out there. And if you want to be published, if you want to be speaking at international conferences, we have that opportunity.
Unbelievable. Well, thank you so much, Dr. Seth Forman. Brody, as always, it's great having you here as well.
All right. Thank you, everybody. Until next time.
Thank you.